What do you think organisations like the Australian Dental Council should do to address cultural safety in the health workforce?
So if accreditation is about the protection of the public, it's an absolute, should be a mandate of accreditation councils to ensure that cultural safety is included. The other piece of advice that I would give, that it's not a substandard of another standard, because it will inadvertently get lost. So given that accreditation is about the protection of the Australian community, making a commitment to addressing cultural safety through your regulatory process is absolutely pivotal. So given that Aboriginal and Torres Strait Islander people are overrepresented in the area of dental issues, yet they're underrepresented in your dental workforce, you need a strategy to be able to address those issues. So it makes sense that you do that. And if you're going to hold your hand on your heart to say that your accreditation process is protecting the Australian public, and especially in respect to dentistry, you want to ensure that it's protecting all of Australia's public, and with the particular focus on addressing what is this country's most vulnerable population at this point in time.
How do you think a standalone domain that requires programs to have regard for cultural safety of Aboriginal and Torres Strait Islander peoples will assist in producing a culturally safe health workforce?
Yep. So having a standalone domain that relates to cultural safety will ensure that the matter is elevated, that it's given the priority that is required, and also role models the Australian Dental Council's commitment, and that it's a priority for the Australian Dental Council as a leadership body. That sends a significant message to all of your profession across the country.
What do you say to some people who might say, well, shouldn't we be culturally safe for all people? We're a multicultural, organisation. Should we have specific regard for, disability and other pressing issues in Australia?
Yep. I would say yes, that's absolutely correct. We should have that. And that's why I'm very specific about when we're talking about cultural safety, we're talking about cultural safety in respect to Aboriginal and Torres Strait Islander people. So the unique elements of that are the colonial experience on Aboriginal and Torres Strait Islander people that have significantly contributed to the overrepresentation of Aboriginal and Torres Strait Islander people within Australia's healthcare system. So if you were to compare health outcomes between Aboriginal people to all of those other groups that you've just mentioned, Aboriginal and Torres Strait Islander people would fare worse on every social indicator still. So cultural safety broadly absolutely has applicability to all of those disadvantaged groups, but there needs to be a separate piece of work because of those statistics to address the challenges when working with Aboriginal and Torres Strait Islander people. Also because they're Australia's first peoples. So to be Australia's first peoples and living in Australia and be the most disadvantaged group, that's a sad indictment for this country.
Why is it important that Aboriginal and Torres Strait Islander peoples are involved in the decision-making within accreditation authorities?
Yep, Aboriginal and Torres Strait Islander people should be involved in any decisions about Aboriginal and Torres Strait Islander people, the same as dentists should be involved in every decision made about dentists in Australia. I answered it in the previous question. It's a fundamental principle of the United Nations rights of Indigenous people, that self-determination is about Aboriginal people making decisions about issues that affect them. Aboriginal good policy and program development means involving the people that are most impacted on by the outcomes, and given that we're developing regulation about addressing the disproportionate representation of Aboriginal people with dental issues, and we're wanting to increase the Aboriginal and Torres Strait Islander dentistry workforce, you need Aboriginal and Torres Strait Islander people at the table to be able to develop strategies to address those issues. And acknowledging the Indigenous knowledge that Aboriginal and Torres Strait Islander people bring. So if you're making decisions about women, you have women at the table, they bring a different perspective, they bring the lived experience. So Aboriginal and Torres Strait Islander people bring all of that to the table. So it's not possible for you to address any of these issues without Aboriginal and Torres Strait Islander people at the table.